Imagine a wheelchair user arriving for a medical appointment, only to realize they must supply their own ramp to enter the clinic. That incident is documented in a 2026 report from the Health and Disability Commissioner. Her office analyzed 1,800 patient complaints from the last 3 years to identify the specific barriers preventing disabled people from receiving safe care. This chart shows the measurable impact of those barriers on mental health. While 12.2% of non-disabled adults report high psychological distress, that number triples to 35.5% for disabled adults. The disparity is even more pronounced for disabled tamariki, or children. They are 8.5 times more likely to face unmet mental health care needs. Understanding why these outcomes are so consistent requires looking past the general pressure on the workforce and examining the specific top-down policy choices that define the system's architecture. The origin of these outcomes can be traced back to the beehive. Recently, the government dismantled Te Aka Whai Ora, the Māori Health Authority, which was established to bypass bureaucratic gatekeepers and fund Māori-led providers directly. Removing this authority severs Tāngata Whaikaha Māori from culturally safe care. For rangatahi, or youth, facing mental distress, the loss of these specific pathways often means the loss of the only support systems they trust. The government then moved to restructure Waikaha, the Ministry of Disabled People. In a single stroke, they stripped the ministry of its responsibility for over $2 billion in disability support services. Responsibility for that funding was handed back to the Ministry of Social Development, the same agency that disabled communities have spent decades describing as a source of systemic failure. By pausing the Enabling Good Lives program, the state ended a model designed to give disabled people genuine choice. This move forces patients back into a postcode lottery, where remote administrators decide what support they qualify for. This restructuring reinstates a centralized gatekeeper model. It places the daily support of disabled people back under the control of state bureaucrats, effectively ending the era of patient self-determination. This shows 63,000 disabled adults went without prescribed medicine last year due to cost. That's 7.4%. Double the non-disabled rate. Concurrently, the government froze disability support pricing while setting aside $216 million for heated tobacco tax cuts. Freezing support while subsidizing industry choice pushes the cost of care onto unpaid wanu caregivers. These family members, disproportionately women, fill the gap by sacrificing their own income and well-being. A system that rations basic prescriptions by income bracket while prioritizing the tobacco industry is not broken by accident. It is operating exactly as its current architects designed it. These policy choices contradict the Y2575 findings from the Waitangi Tribunal. The report explicitly states the Crown is in breach of Te Tiriti o Waitangi for failing to design primary health care that addresses Māori health inequities. The government has ignored the tribunal's recommendations to share decision-making power and to compensate for decades of documented underfunding. Because Aotearoa lacks a constitutional mechanism to stop Parliament from dismantling Indigenous health structures, there is no legal brake to prevent the state from overriding these rights. Accountability is further obscured because the same state agencies responsible for the failure are the ones who author the reports meant to expose it. In Te Ao Māori, health is defined by haurora, the inseparable connection between wairua, the spirit, hinengaro, the mind, tinana, the body, and whānau. Dismantling culturally safe systems transforms the health service into a sorting machine. For Tāngata Whaikaha Māori, this architecture produces early graves. True equity requires a treaty-consistent, disability-led system. It requires that the communities who rely on these services are the ones who control, co-design, and fund them.